All right, so my SMART goal is Ariany Garcia-Palmer, will eat 3 to 5 servings of fruits and vegetables a day for 4 days out of the week until May 19th. My health risk assessment identified my body mass index as a health risk. Based on this risk, my health promotion need was to eat healthier meals throughout the day to decrease my BMI, and I kind of met my SMART goal. One of my goals was to cook healthy meals and shop for healthier foods at the grocery store. A barrier to this goal was having the time and money to buy these groceries and cook meals after work or school. A woman who is pregnant is from a different health population but could still face the same barriers as me. Being pregnant could possibly negatively or positively impact if the pregnant person has time or is in pain to cook or go to the grocery store due to pregnancy changes, as well as cravings and nutritional needs based on their BMIs. A different barrier a pregnant person faces could be having morning sickness and not being able to keep anything down, not even water or dry foods like crackers, due to the severity of morning sickness that usually occurs in the first trimester of pregnancy. In the example of a pregnant person and healthy eating habits, the RN can take into consideration the inclusion of the patient. For example, during pregnancy, it is recommended to consume certain amounts of calories based on their BMIs and how far along they are in their pregnancy. These people are also advised to consume certain supplements like folic acid, prenatal vitamins, iodine, etc. to eat healthy during their pregnancy and gain the appropriate weight for the health of the mother as well as the fetus. And I got this information from OSH that was published in 2023. In the example of the pregnant individual and healthy eating habits, the RN can individualize the health education and information by having infographics or pamphlets available with the examples of food options high in fiber, protein, and whole grains, and when in pregnancy, they can consume these foods. With the rise of postpartum depression and the negative impacts it has on mothers about their body and appearance, many women want to start dieting right away after birth, but it's usually not recommended to start dieting and exercising right away, especially if they're going to breastfeed, because the baby needs as much nutrients as possible, and the mother needs to be able to provide that in their milk. So I used nursingtheory.org to understand the Pender's health promotion model. And after reading their website about the theoretical statements made by the health promotion model based on the behaviors, it stated, quote, "Families, peers, and healthcare providers are important sources of interprofessional influence that can increase or decrease commitment to an engagement in health promoting behavior." So that's Nursing Theory 2023. We as nurses have such a critical and important role in empowering people to commit to their healthcare goals and influence their behavior that may be hard to understand at first or even recognize to begin with. And with that being said, the best way we could do this is through education. For example, educating pregnant individuals in their prenatal visits about the importance of a balanced diet and nutrition, and having a specific plan for their pregnancy and situation or experience.